Let's talk about your body's number one fortress, your skin. I mean, it's this incredible barrier that's constantly protecting you from all sorts of invaders. But what happens when that fortress gets breached? Today, we're going to break down a really common but often misunderstood skin infection called cellulitis.
Seriously, think about that for a second. Your skin is on guard 24/7. So what happens when that defense line fails? That's really the big question we're diving into. And the answer, well, it involves a full-on bacterial invasion that can get serious fast if you don't know what you're looking for.
So, first things first, we need to understand exactly what we're dealing with here. What is cellulitis really? Okay, and here's the absolute key thing to get. This is not just some surface level rash. Cellulitis is an infection that gets way down deep into your skin's architecture. We're talking the dermis and the fatty tissue underneath. That's why it's a much bigger deal than other skin issues. The infection is happening inside the walls of your fortress.
And right off the bat, let's just clear up a huge misconception. You cannot catch cellulitis from another person. It's not something you can pass along through touch or just by being near someone. The whole thing starts because of a break in your own skin, not because of contact with someone else.
So, how in the world do these little bacterial invaders actually manage to get past your skin's defenses? Well, the process is actually surprisingly simple. It all kicks off with a simple break in the skin. Could be anything, a tiny paper cut, a scrape, a bigger wound. That little opening is like an open door for bacteria that are usually just hanging out on your skin's surface, not causing any trouble. But once they get inside, deep down where they don't belong, they start to multiply like crazy. And that's what triggers the infection and your body's big inflammatory response. So what do these entry points look like in real life? Well, they're usually things we deal with all the time. A simple scrape on your knee, a nagging mosquito bite, a healing surgical cut, even just really dry, cracked skin can be the perfect opening for bacteria. And, conditions like athlete's foot, which can cause little cracks between your toes, are super common culprits.
All right, so who are the actual invaders here? Well, most of the time, cellulitis is caused by two very famous types of bacteria. Streptococcus, you probably know it as strep, and staphylococcus, or staph. You've heard of these guys. They're literally all around us and even on our skin. But they only turn into a problem when they find a way into those deeper layers.
Now, while pretty much anyone can get cellulitis, some of us have fortresses that are just a little more vulnerable. For instance, if your immune system is weakened for any reason, it's just going to have a tougher time fighting off that initial invasion. Chronic skin conditions create more of those potential entry points. And if you've actually had cellulitis before, the defenses in that specific area might be a little weaker, which makes you more likely to get it again. Knowing how the invasion starts is definitely half the battle. So now let's talk about how to spot the signs early. What are those red flags that tell you, hey, an infection might be underway here?
Okay, there are 4 classic signs of cellulitis you really want to watch for. First up is redness that seems to be spreading. Along with that, you'll see swelling, and the area will be painful or tender if you touch it. And finally, the skin will feel warm. You can even check this with the back of your hand. It'll feel noticeably warmer than the skin around it. That's your body's alarm system going off.
Now here's a really specific visual to lock into your brain. As all that fluid builds up and causes swelling, the skin can sometimes get this dimpled or pitted look. Doctors often say it looks like the peel of an orange. If you see that, it's a pretty strong signal of some serious inflammation happening underneath. And if the infection starts to get more serious, it's not going to just stay local. Your whole body might sound a system-wide alarm. We're talking about things like a fever, getting the chills, or even seeing blisters form on that red, swollen skin. These are all signs that the infection is getting worse, and it's definitely time to get medical help right away. Now, the good news here is that you don't usually need a bunch of complicated tests to figure this out. For a doctor or nurse, diagnosing cellulitis is typically pretty straightforward. They can usually tell what's going on just by looking at the skin and hearing about your symptoms.
All right, now that we know how to recognize the enemy, let's talk about how to fight back. We're going to cover how you defeat an active infection and, just as important, how to fortify your defenses for the future. So, the number one weapon against this bacterial invasion is antibiotics. For most cases, just taking pills by mouth is enough to knock it out. If the infection is really severe, your doctor might want to use IV antibiotics, which you'd get in a hospital. But listen, here is the most important part. You have to take the entire course of medication, even if you start feeling way better. Stopping early is like letting the toughest bacteria survive to fight another day.
And here's a little bit of reassurance. Once you start treatment, relief is usually not too far away. Most people start to see the redness, the swelling, and the pain get better within about 3 days. It's a great sign that the antibiotics are winning the war.
You know, treating an infection is one thing, but stopping it from ever happening in the first place, that's even better. It's all about being proactive and making sure your skin's defenses stay strong.
Smart wound care is your first line of prevention. And honestly, it's so simple. Just 3 steps. First, always wash any cut or scrape with good old soap and water. Second, put on a protective ointment, like petroleum jelly, to keep it moist and create a barrier. And third, cover it up with a clean bandage until it's healed. That's it. And finally, remember that fortifying your fortress is a daily job. Keeping your skin moisturized helps prevent those tiny cracks that let bacteria sneak in. If you get something like athlete's foot, treat it right away. And if you have a condition like diabetes that affects your circulation, it's a great idea to check your feet and legs every single day for any little cuts or sores you might not have even felt.
So, at the end of the day, preventing cellulitis really comes down to good wound care and just taking care of your skin. The tools are simple, but they are absolutely your best defense. Which kind of leaves us with one final thought. Is your first aid kit really ready for battle?